Hello everyone. Today we are going to study the knowledge on the spine. First, we are going to study the anatomy of the spine. The spine is a pillar of the human and is composed of spine bone and intervertebral disc. The former accounts for 3/4 of the spine and the latter accounts for 1/4. It is connected with strong ligament and attached with many muscles. It has the functions of loading gravity, cushioning concussion, supporting the body, protecting the spine cord and organs. The spine includes 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, and 4 to 5 caudal vertebrae. The spine has 4 curved physiological arcs, includes cervical lordosis, thoracic kyphosis, lumbar lordosis, and sacral coccygeal psychosis, which cushion the impact and oscillation of external force on the spine. A typical vertebrae can be divided into 2 parts, vertebral body and vertebral arch. The vertebral body is anterior, which is the weight-bearing part. The posterior side of the vertebrate body is the vertebral arch, forming the pedicle, vertebral plate, superior and inferior articular process, transverse and spinous process. The vertebral foramen is formed by vertebral body, the pedicle, and vertebral plate. The foramen of each vertebra is connected to form the spinal canal, in which the spinal cord and caudal inguinal pass through. The superior and inferior pedicle notches form the intervertebral foramen, which is the spinal pathway. From the second cervical vertebra to the first sacral vertebra, the inferior articular process of the adjacent superior vertebra and the superior articular process of the inferior vertebra constituted the zygapophyseal joint, surrounded by strong articular capsule, which is amphiarthrosis. The shape and arrangement direction of the zygapophyseal joint in each segment vary according to range of motion and direction. Each zygapophyseal joint is arranged and the articular surface is smooth. In case of injury, it may lead to traumatic arthritis, result in chronic back pain. The pedicle of each vertebra is the strongest anatomical structure, and it is known as the fourth center of the vertebra. Intervertebral disc and ligament connected between the vertebrae with a strong ALL in front of the vertebral body, which is the longest ligament in the human. The PLL behind the vertebral body. A thin and tough ligamentum flavor between the adjacent vertebral plates, with an interspinal ligament between each spinous process, and supraspinal ligament at the end of spinous process. From the 7th cervical spine upward, the supraspinal ligament moves as nuchal ligament. There are 23 intervertebral discs, which are surrounded by tough and dense annulus fibrosus closely attached to the cartilage plate, connected the adjacent vertebral body. Their center is surrounded by nucleus pulposus, which is important in spinal movement and stability. The annulus fibrosus is on the outside of the disc and is composed of cartilage tissue, the anterior part of which is closely attached to the ALL. The posterior part is loosely attached to the PLL. The spinal cord is in the spinal canal and splits 31 pairs of spinal nerves. The spinal cord corresponding to each pair of spinal nerves is a segment. During development, the growth rate of spinal cord lags behind the spinal canal, At adult age, the end of spinal cord is opposite to inferior end of the first lumbar vertebra or superior end of the under one, so the spinal cord segment is not consistent with its corresponding plane. Spinal cord has three functional areas. Cervical enlargement is the area of brachial plexus origin, dominating the movement and sensation of the upper limbs. The circumference of the thoracic spinal cord is approximately the same, and the lumbar enlargement is the area of lumbosacral plexus origin, dominating the movement and sensation of the lower limbs and the spontaneous urination function of the bladder. The nerve root that originates from the lumbar enlargement runs longitudinally downward and becomes the conda equina around the filum terminale. It is located in the spinal canal below the second lumbar vertebra and suspended in cerebrospinal fluid. The movement and stability of the spine not only rely on the integrity of spinal bones and ligaments and intervertebral discs, but also rely on the relaxation, contraction, and fixing effects of muscles around the spine, and muscle injury, deregulation, and movement disorders can lead to weakening or loss of spinal stability. It can be concluded that muscle is an external balance factor of spinal stability, and the two complements are indispensable. Therefore, in the diagnosis and treatment of spinal injury, full attention should be paid to the relationship and influence of ball joint and soft tissues. Next, let's take a concrete look at the structure of the neck. Cervical spine is the smallest vertebra in the whole spine, with 7 cervical vertebrae in total. The first, second, and seventh cervical vertebrae have special structural morphology and belong to special cervical vertebrae. The third, fourth, fifth, and sixth cervical vertebrae are common cervical vertebrae, and the cervical vertebrae bodies are small and oval, with a depressed transverse diameter above them and a shallow notch at the inferior margin of the arch, increasing the stability of the cervical spine. The front side of the vertebral body is elevated in arc. The articular surface of the superior articular process is posterior superior. The inferior articular process points and roll inferiorly, and the angle between the articular surface and the horizontal plane is smaller than that of the thoracic spine, about 45 degrees. Vertebral body is susceptible to dislocation or subluxation caused by flexion violence. The lateral margin of the vertebral body has a lip-like process connected with the superior vertebral body, which is a Luska joint or unconvertible joint. The vertebral arch is narrow and long, and the vertebral foramen is large and triangular or oval. The articular process is short, thick, and columnar, and originates from the junction of pedicle and vertebral plate. The cervical vessel is mainly the vertebral artery, which generally rises after originating from the first segment of the subclavian artery, pass through the transverse foramen, except for the 7th cervical vertebra, pass through the transverse foramen of the atlas, bypass the vertebral artery sulcus behind the lateral mass of atlas, and turn superiorly through the foramen magnum into the brain. The cervical spine can complete extremely complex activities in 3-dimensional space, including flexion, extension, lateral flexion, and external rotation around the coronal axis. sagittal axis and longitudinal axis, of which 16% of the rotational function reached is completely by the atlantoaxial joint. The moment axis of cervical vertebra is located in the central part of nucleus pulposus. Therefore, when the cervical spine flexes anteriorly, the spinal canal can become longer due to traction. Conversely, when the cervical spine is hyperextended, the spinal canal can become shorter and the spinal cord loosens and thickens. Let's take a look at the structure of the lumbar spine. There are a total of 5 lumbar vertebrae in normal people. The lumbar spine is longer and thinner than the cervical or thoracic vertebral bodies. It is mainly composed of cancellous bone. The dense bone in the outer layer is thin and slightly wedge-shaped, and the transverse diameter is greater than the anteroposterior diameter. Since the load on each vertebral body from top to bottom of lumbar vertebra gradually increase, the characteristic of gradually increased volume of vertebral body from L1 to L5 can make the function of load bearing and force transmission of lumbar vertebra more stable. For the zygapophyseal joint of lumbar spine, the articular surface spine is arc-shaped in the transverse spine, so it will not hinder the flexion and extension and lateral flexion movements of the lumbar spine, but it will make the trajectory center of lumbar spine located in the posterior body during rotation. So a little rotation of this small joint can result in a large range of motion of the vertebral body. This can effectively limit the rotational moment of the lumbar spine, while on the other side, it is also easy to lead to intervertebral disc damage and degeneration. Unlike cervical and thoracic spinal process, the spinal process of the lumbar spine is generally horizontal, and L5 spinal process is often twisted and deformed or polyfused, leading to spinal bifinder. L3 transverse process is the point of strength of lumbar muscles, which is susceptible to local fixation attachment strain, resulting in low back pain symptoms. L5 transverse process closely connected to the ilium and scrotum by the iliac lumbar ligament, so it has a stabilizing effect on the lumbar spine. The lateral recess is a narrow space in which the spinal canal extends laterally. It is mainly in the trileaflet spinal canal and in the 2 inferior lumbar vertebrae. The narrow part between the superior and the inferior articular process of the lumbar spine is called the pedicle isthmus. If the sclerotine of one or both isthmus is discontinuous, it is called spondylolysis or isthmus spondylolysis. Lumbar spondylolysis is one of the common causes of clinical low back pain. Combined with anatomical characteristics, the imaging examination of spine mainly relies on X-ray, CT, and MRI. Let's first have a look at the X-ray examination. Radiological examination of patients with cervical spine trauma is often difficult because loss of consciousness, risk of intercurrent injury, and the risk of cervical cord injury from unnecessary movement. It is often limited to 1 or 2 projection positions. In such condition, lateral radiography is the most valuable projection position. Lateral radiography of the cervical spine in the lower part of the skull is important to access vertical subluxation of the cervical spine involving the atlantoaxial joint, which is characterized by displacement of the odontoid process into foramen magnum. In the anteroposterior film of the cervical spine, vertebral body C3 to C7 on convertebral joint and in vertebral space can be clearly visualized. The spinal process is almost erect and appears as a round shadow like a teardrop when projected. Note that a change in position for anterior-posterior photograph is the mouth open position, which is no part of a standard examination. The structure of the first and second vertebral bodies can be fully visualized at the mouth open position and vertebral body C2 and lantoaxial joint, odontoid process, and the space between odontoid process and the lateral mass of the atlas can be clearly visualized. Oblique radiograph of the cervical spine is not a routine examination, but sometimes it is particularly important for displaying acute fractures of the vertebral arc and lesions of the neuroforamen and articular surface. While CT can determine the degree of the spinal cord and soft tissue injury in general, it can also provide relevant information on the integrity of the spinal canal and the location of the intraspinal fracture fragments. Magnetic resonance imaging has the ability to have high imaging quality and to complete multi-dimensional imaging of emergency trauma patients without moving patients. While makes MRI the most effective examination method for evaluating spinal trauma at present. Well, that's all for this lesson. I hope you can actively review relevant contents after class. Thank you.